Welcome again to another session of Your Questions Answered. I'm Rowan Kernebone from the Injured Workers Support Network. We're joined today by Prinola from the Workers Health Centre. Prinola, do you want to give a bit more details about yourself?
Absolutely, Rowan. So I look after the same employer team and the training services as part of Workers Health Centre, here operating out of Granville.
Okay. Prinola, the question we have for you today, that's just been asked by our members, is what is suitable duties?
All right, now that's a great question. I guess to start off with, we'd be looking at suitable duties based on what is on a person's certificate of capacity. So that would be the second page, about midway down, where a doctor would say you can lift X number of kilos, you can sit, stand for this much time. We would look at that information, and based on that, we would then be looking at what suitable duties would be appropriate to match what is being stated on your medical certificate or your certificate of capacity, which is the current term that's being used. Now, going back to the actual definition of suitable duties, that would be sourced at the employer's end. So if you were, for example, let's look at somebody who's working in a warehouse. If you were picking and packing, for example, and you would be lifting up to 15 to 20 kilos from shoulder height to waist height, and you might have a shoulder injury, we'd go to the employer and say, well, look, the certificate of capacity states that this person can only lift up to 5 kilos and they cannot lift up to shoulder height. They can work between knee to hip height, for example. What duties can you provide that would be aligned to what the doctor is stating on the certificate of capacity? So in a nutshell, it's making sure that the duties that are being provided by the employer are aligned to what is stated on the certificate of capacity.
Okay, that's very precise. That was a good question. Good answer. You're talking about the duties that somebody's already doing. Now, one of the things that we're aware of here is that that's not always possible to do. That sometimes you have to look at alternatives, even with the same employer. Would that be your understanding as well?
That would be. So let's look at somebody, for example, who sustained an ankle injury. And let's look at the same example of somebody who would need to work in a warehouse. If they've sustained an ankle injury, can't wear safety boots, that would mean they cannot be on the factory floor, the warehouse floor. Now, what we would then discuss with the employer, and when I say we, it's we as the health professional that would be representing the injured worker, or your rehab services provider, if that's what you would like to call us. But we're really health professionals, and if you're working in the same employer space, that's a physiotherapist or an occupational therapist or an exercise physiologist who might be assigned to help you and the employer find those suitable duties. So going back to that example, you couldn't wear your safety boots, but your doctor says, yes, you do have capacity, you can be at work and you can do something. But if you were on the warehouse floor, perhaps driving a forklift or doing some picking and packing, and you couldn't now do that because you couldn't wear your safety boots, we would then be looking at other roles. Now keep in mind, that doesn't mean that we're changing your role. That just means that we are going to the employer and we're saying, the certificate of capacity states this, can you provide alternate roles within the employer, within that same location, for this person while they are recovering. So it's an interim measure to assist with the recovery.
And when we're talking about the certificate of capacity, we're really talking about the injured workers doctor.
That's right. So that would have been, that information would have been written by the injured workers doctor, correct?
Yeah. Okay. There is scope within the system at the moment, though, to retrain someone to expand the range of suitable duties that they might be able to do. That's right, isn't it?
That's right.
Okay. And if that's the case, then as a rehab provider, you'd be looking into thinking of that and contemplating it with the employer.
Absolutely.
If there was possibility to do that as well.
That's right. So going back to that example that I've just used of the person not being able to go back onto the floor because of an ankle injury and not being able to wear safety boots, what else could they do? So we would probably say, well, what about some office type duties that they could do? If that perhaps included working in receiving or logistics, and they might not have ever done that before, how are we going to assist to keep that person at work? That would mean providing some additional upskilling, some retraining, but within the employer to help them do those suitable duties. Ideally, that's what we would love to see happen, and it doesn't happen all of the time.
No.
So an employer could turn around and say, well, no, we don't have those duties available. We need the person to be able to wear a safety boot and return to the warehouse floor. So it is something we would bring up with an employer, and look, we would go in with the hope that they would oblige and provide that retraining to assist the person to stay at work while they are recovering.
And that's the difference between the professional and the rehabilitation field, coming straight up against the legislation and the current workers' compensation system, which we're trying to fight to change.
Mm-hmm.
Okay.
Cool.
I hope that helps answer the question, suitable duties. What is a suitable duty? If you have any further questions, please go online to www.injuredworkersupport.org.au or IWSN.org.au, or give us a call on the number there, 9749 7566, and we'll try and help you out with those questions and answer it. If you've got any other questions for us, please let us know. We'll try and get somebody in to talk about them directly. Prinola, thank you very much for your time.
Thank you for the opportunity, Rowan.